Question 21. If a resident's behavior becomes combative, the nurse aide should A. Tell him to calm down or restraints may be necessary. B. Show him that the nurse aide is in control. C. Ask a co-worker to witness the situation. D. Communicate calmly while stepping out of the way. Answer D. Explanation. If you are hit by a resident while giving care, notify the nurse. You may be asked to complete an incident report. If you are injured, get treatment. Always remove yourself from harm by stepping out of the way of the resident's reach. Remain calm and explain that hitting is not acceptable. Question 22. Which one of these behaviors is not a signal of possible combativeness? A. Clenched mouth and teeth. B. Saying, I am angry. C. Fist in a ball. D. Rapid eye movement. Answer B. Explanation. Non-verbal signs can tell you more about a person's mood than their words. Non-verbal cues often come from instinct. Observe the signals that tell you a person is angry and ready to strike. If words and behavior do not match, always believe the behaviors or actions. Question 23. In a reality orientation program, you would do all of the following except A. Ask them to identify the smells of their meal. B. Show them the weather outside the window. C. Ask the resident about their childhood. D. Tell them the date and time each morning. Answer C. Explanation. Reality orientation is a formal program that involves repeating information to help residents understand their surrounding. To keep a resident oriented, the name is used frequently. Information such as date and time are reinforced with calendars and clocks. Show residents the weather and ask them to identify smells and taste. Question 24. A resident with Alzheimer's disease has a baby doll that she carries with her and cares for. When she misplaces the doll, she begins to cry. What should the nurse aide do? A. Quickly find a new doll to replace the lost one. B. Tell the resident that it was only a doll. C. Comfort the resident as if the doll were real. D. Allow the resident to cry until she stops. Answer C. Explanation. Dolls therapy can be useful for people with Alzheimer's disease. Studies show that dolls can calm and soothe residents, as well as decrease wandering. A doll can also improve speech and communication. Because the doll is real to the resident, the loss is treated accordingly. After a short time, a new doll can be introduced to the resident. It is important to note that males can enjoy dolls too. Question 25. A person with dementia is being admitted to your facility. Which statement is correct? A. Family members are asked to leave to help the person adjust. B. The admission process is completed as quickly as possible. C. The person's confusion may increase in new surroundings. D. All of the above. Answer D. Explanation. People who have dementia or Alzheimer's disease have a different process for their transition into a long-term care facility. The process is fast, with much of it done before the person arrives. To help them adjust, the family does not stay but leaves so the staff can begin to help the person meet others with similar conditions and learn their new routine. Sometimes the family does not return until the staff feels the person is ready for a short visit. Question 26. A nurse aide finds a resident looking in a refrigerator at the nurse station at 5 a.m. The resident, who is confused, explains that he needs breakfast before he leaves for work. The best response by the nurse aide is to A. Tell him that residents are not allowed in the nurse station. B. Remind him that he is retired from his job and in a nursing home. C. Ask the resident about his job and if he's hungry. D. Help the resident back to his room and into bed. Answer C. Explanation. When residents who are confused think they are still have a job, are excited about new job, do not contradict them or try to convince them they have no such thing. Do not play along with their misunderstanding. Simply ask them about the job and redirect them. You can say, that sounds important. Let's have breakfast first, okay? Give them a task, take a walk, or take them to another activity. Question 27. A good way to reduce confusion or agitation for residents with dementia is A. Include a variety of activities for stimulation. B. Treat assignments so they get to know all staff. C. Follow a familiar schedule every day. D. Ask them what they want to do. Answer C. Explanation. Residents with dementia can have fearful thoughts, such as if anyone is going to help them or if they are going to starve. With a regular schedule, they know what is going to happen next. I wake up, I go to the toilet, I get dressed, I have breakfast. Routines are predictable and reassuring, even if they're boring for the staff. Question 28. When you approach a resident with dementia, how should you behave? A. With an "I'm busy, let's get this done" behavior. B. With a meek, submissive demeanor. C. With a cold, professional attitude. D. With a relaxed and cheerful manner. Answer D. Explanation. Patients with dementia can detect moods and attitudes and act in a similar manner. If you are not involved, distant or busy, the resident can detect this and react in a fearful way. If you are meek, they may try to take advantage of you. With a positive attitude, they can sense your non-judgmental and relaxed demeanor and will respond accordingly. Question 29. When the nurse aide tries to dress a resident who is confused, the resident keeps trying to grab a hairbrush. The nurse aide should A. Try to dress the resident more quickly. B. Give the resident the hairbrush to hold. C. Restrain the resident's hand. D. Push the hairbrush away and out of sight. Answer B. Explanation. Offering a resident something to hold while performing a task can make the resident feel secure and allow the nurse aide to proceed more easily. For example, let them hold a washcloth during a bed bath. If they have a favorite small object, they can also be a good source of comfort. Question 30. Mr. Russell keeps getting up from his wheelchair. Instead of using a restraint, you should ask him if A. He needs to go to the toilet. B. He would rather go home. C. He wants to sit alone in his room. D. He is just being difficult. Answer A. Explanation. If it is never appropriate to use a restraint for punishment or staff convenience, also never threaten a resident with restraints. Restraints can only be applied with the doctor's order for specific reasons. Trying to find out what the resident needs. Often they require toileting, are thirsty or hungry, or have a reason they want to get up. Question 31. Reality orientation therapy should include A. Telling the resident that they will be going home soon. B. Creating imaginative stories to amuse the resident. C. Calling the resident by a name such as Grams. D. Addressing the resident by their proper name. Answer D. Explanation. Reality orientation involves repeating information to help clients understand their surroundings. To keep a client oriented, their name is used frequently. Information such as date and time are reinforced with calendars and clocks. Question 32. A 90-year-old resident tells you that his mother is coming to visit on Sunday. What is your most appropriate response? A. That is impossible. Your mother is dead. B. Okay, let's figure out how old your mother could be. C. How nice. What are you going to do when she gets here? D. Are you wishing you could see your mother? Answer D. Explanation. When residents who are confused about the past, do not contradict them or try to convince them they have no such thing. Do not play along with their misunderstanding. Look for the real meaning behind their words and behavior. You can say, "Tell me what your mother's was like. What are your best memories?" Question 33. If a resident becomes confused, you should A. Place him in his room so he won't wander. B. Put him in restraint so he won't fall. C. Help the resident recognize familiar items. D. Sit him down until you have time to assist him. Answer C. Explanation. When the resident seems confused, start by offering basic information. "Hello, Mr. Roberts. I'm Sally, your nurse aide. Do you remember me?" From there, offer other ways to help him regain his sense of time and place. It's Tuesday, August 26th. You had chicken for lunch and watched the movie. Returning the resident to his room to look at familiar objects and photos can also be helpful. Always remain calm and friendly. Question 34. When caring for a confused resident, what should a nursing assistant do? A. Give simple and direct instructions. B. Provide a different schedule for variety. C. Allow the resident to plan the day. D. Offer the resident a choice of 10 activities. Answer A. Explanation. When speaking to a client who is confused or agitated, use a calm voice. Talk directly to the client, saying their name. Use short sentences and allow time for the client to respond. Be respectful and always treat the client like an adult. Question 35. A resident with dementia has wandered to another unit. What should the nurse aide say after finding the resident? A. Let's go. Don't you know I have work to do? B. Let's walk back together, okay? C. Do you think you're Christopher Columbus? D. How on earth did you get here? Answer B. Explanation. 6 out of 10 patients with dementia will wander. Even in the early stages, a resident can become confused for a short time. They may be restless or trying to do formal activities such as going to work or go home. Question 36. The Global Deterioration Scale, GDS, helps caregivers understand how people decline when they have dementia. Of the 7 stages, which stage has no sign of dementia? A. Stage 2, B. Stage 6, C. Stage 7, D. Stage 4. Answer A. Explanation. CNAs who work in a facility with residents who have dementia or Alzheimer's disease will become familiar with the GDS. Stages 1 to 3 are pre-dementia with non-fulfilled signs of decline. Stage 4 has signs of inability to concentrate, finishing tasks, and social withdrawal. Stage 5 includes some assistance with ADL and inability to recall current information, such as date or where they are. Stage 6 requires extensive help with ADL, incontinence, and inability to recognize family members. Stage 7 requires complete care as well as inability to speak or walk. Question 37. When preparing to give pre-care to an incontinent female resident with dementia, the CNA knows A. The resident may become tearful. B. The resident may feel sexually assaulted. C. The resident may become combative. D. All of the above. Answer D. Explanation. Even under the best situations, giving primary care can be awkward or embarrassing for a resident. For a resident with dementia, cleaning the genital area can cause various reactions. If the resident feels threatened or fearful, they may strike back. If they have a history of unwanted sexual actions, they may cry or complain of being assaulted. Always tell the resident what you are going to do and why. Describe each step before you do it. Speak in a calm manner. Question 38. Mrs. Johnson, a resident with dementia, loves to wear her favorite blue plaid shirt with her favorite green striped pants. What should you do? A. Respect her choice of clothing. B. Insist on picking out her outfits. C. Tease her about her sense of style. D. Keep her in her pajamas all day. Answer A. Explanation. Respecting each resident includes allowing them to make as many choices as possible. There is no harm in mismatching clothing. There is probably a reason that Mrs. Johnson likes these clothes and feel good in them. Ask her to tell you if she can. Allow her to select her outfits as often as possible. Question 39. Which of the following can be a cause of intellectual disability? A. Down syndrome. B. Childhood illness. C. Birth complications. D. All of the above. Answer D. Explanation. Intellectual disability, ID, is a below normal intelligence and ability to perform basic tasks. ID can be caused by something that happens before birth, such as exposure to alcohol or drugs, or an infection. An example of a chromosomal disorder is Down syndrome. ID can be caused by an inherited condition such as Tay-Sachs disease or PKU. Problems with the birth, such as oxygen deprivations or premature delivery, are two more reasons. Even infections such as meningitis or whooping cough can result in ID. Question 40. Some patients may exhibit some false beliefs not supported by facts or reality. This is known as A. Deliberation, B. digression, C. duration, D. delusion. Answer D. Explanation. Delusions are false beliefs that involve a misinterpretation of experiences. A person may believe that they are being followed, tricked, or spied on. They may also be convinced that songs or books contain special information meant for them. Attempts to show the person that their belief is wrong or irrational are not accepted by the person. Thank you for watching.